Hi everyone, and welcome again to another video. In this video I wanted to answer some great questions that were posed by a few of our members. So the first question is from Amanda, and she asked how to get a dog to lose weight if they've got hip dysplasia. I hear this all the time. There's so much conflicting information out there about, do you exercise a dog who has hip dysplasia or should you rest them? And my big takeaway for you all is they need to exercise because they need to build muscle around their hips. That can be one of the biggest determiners of stability and helping to reduce their pain around their hips. So by all means exercise them, but you want to maximize the amount of low impact activity you're doing with your pet and not doing too much all at once. So slow and steady wins the race, and you want to do more leash walks and low impact type of things rather than fetching the ball. So some ideas that I usually tell people that you can do to even increase the dog's activity during their daily activities is you can give them food puzzles or put their food in small containers all around the house, and you can have them actually walk and try to search out their food, so that gives them a little bit more activity. If longer leash walks are a problem for your pet, then break them up into smaller, more frequent walks during the day. Swimming can be a great option if you have access to water that way, but again, you don't want them running and jumping off of a dock or jumping down into the water from a tall height. So just kind of an easy access in and go swimming. The big thing is any activity that you do with your dog, then you want to build up over time so that they don't get too sore. The second question, and also the third one, is from Laura. Her first question was, what are the best options for medications when surgery is not an option? So first of all, I want to say I'm not a veterinarian, so take what I say with a grain of salt, and always consult with your veterinarian before you start any supplements or medications. But for very mild cases of hip dysplasia where they're not overly symptomatic, I would say start with doing supplements. So a joint supplement such as Cosequin or Dasequin is good. Fish oil can be a good supplement. And there are a lot of other good joint type supplements like Flexidin. So again, you can consult with your vet to see what might be the best option for your pet. In terms of medications, once they start becoming a little bit more painful, early on still you could do Adequan. This is actually an injectable supplement. It's a nutraceutical, so it's not really a drug. It's a substance that our body produces naturally. It does have to be given by injection under the skin or in the muscle, but if you are comfortable learning that and your vet's comfortable teaching you, they can actually teach you to administer that. I like it because it is a more natural substance, so you don't have to worry about the kidney and liver issues that you do with some of the other pharmaceutical drugs. But there will come a point with most of the dogs with hip dysplasia where they do become painful, and at that point then you probably want to look into an anti-inflammatory such as Metacam or Rimadyl, and in the more end stages or in the more severe cases, then they may want to add a pain medication such as gabapentin or tramadol to help boost the effects of the anti-inflammatory. But again, definitely talk with your veterinarian about what's appropriate for your dog's particular case. Laura's next question is, should I eliminate all stairs? So that's a really good question, and it depends. So I think stairs are okay, but you want to make sure that your dog can do them safely. So especially hardwood stairs that are slippery, or very steep stairs down into the basement, I would monitor. You can always use a towel under their belly, or one of the reusable shopping bags that you can cut the accordion ends out of so that it looks like a fireplace log carrier, and you can put that under their belly just to make sure that they're safe with their hind end. So stairs aren't necessarily bad unless the dog can't really maneuver or support their weight safely on the stairs. And in those cases, I would say definitely help your dog up and down the stairs. So Allison asked, is there an age that's best for total hip replacement? You know, is there an age that's too young or an age that's too old? So this is a really good question. So total hip replacements cannot be done until the dog is skeletally mature. So the surgeons always want to wait until the dog is done growing, essentially. So for most dogs, this is anywhere from about 10 to 12 months up to about 16 to 18 months in the giant breeds. But once that hip is fully formed and fully grown, then any time past that is essentially okay. I think personally what I have seen is dogs that start getting into the 10, 11, 12 year mark, a lot of times start to lose muscle mass just from the aging process. And at that point, then it can be a little bit more difficult for them to recover from a total hip replacement. Also, cost is a factor, and although we want our pets to live forever, there is a certain amount of time that we can expect them to survive. So do you want to do a $7,000 or an $8,000 surgery at age 12 or 13? So between the recovery time and the expense, that may not be the best option. But I think as long as the dog is healthy and has a decent amount of muscle mass before the surgery, any time between basically 1-ish years of age on up to, as long as they're healthy and happy and have a good amount of muscling, the total hip can be done. And then our last question came from Richard, and he was asking about hydrotherapy. Specifically swimming versus an underwater treadmill, and which one is the best, and or what factors kind of determine why you would do one over the other. So I think this is a great question. So personally, I feel that for most dogs with hip dysplasia, an underwater treadmill is a better option, because not all dogs will consistently use their back legs when they swim. So the underwater treadmill is going to give them more range of motion, especially into extension, which is bringing their leg back behind them. And that is actually one of the motions that I see dogs with hip dysplasia lose usually first. So I think, and also being able to raise or lower the water can alter their gait pattern a little bit, so you can really kind of fine-tune the walking pattern that you want in the treadmills. Swimming, I think, is good for dogs that either have more mild cases or who are at a really good fitness level, because aerobically I think that swimming is more difficult than the treadmill exercise is. But sometimes it just comes down to what you have access to. And I think both of them have their pros and cons. And I think that, again, whether you choose underwater treadmill or swimming or both, start slow and slowly build their endurance up so that they're not too sore. So I hope you found this helpful, and I will post another query in a couple of weeks asking for some more questions, and hopefully give you some good answers. So have a good day.